All right. Well, hello, everyone. Hello, and welcome to another episode of the Tiny Brave podcast. Today, we're welcoming my dear friend, Kathryn Alexander, who is, how do I describe Kathryn? Okay. So she started her professional career as it relates to today's conversation as a dietary therapist and then later as a naturopath. Before that, she was a musician. She became a patient advocate and a researcher and teacher. She is one of the wisest people I know. And she is a true delight and joy to spend time with. So I'm really so happy to have you here today, Kathryn. Thank you for saying yes. What did I miss in the intro?
I don't think you missed anything. Nothing. It's a delight to be here with you today.
Yeah.
Yeah.
All right. Well, so these Tiny Brave conversations are an exploration of what we could call almost grounded courage. So what does courage actually mean in the context of our day-to-day lives and it, through the lens of particular domains of our lives? I'm really interested in talking to you to start with about your perspective on what courage means in the context of our health.
Okay. So I actually knew you were going to ask me this question. So I had to look and say, well, what does courage mean? I had to unpack it. And for me, it's when you've got to take action or stand up for something and you know that the odds are totally stacked against you and that it could all go pear-shaped, utterly pear-shaped. That's what courage and bravery is. And in health, probably there's no other environment that matches how much bravery a person has to have if they decide, I don't like where my medical team is taking me, and I need to do something about it myself, because the risk of isolation in an environment where medicine or health has become so, what shall I say, medicalized, where there's no room, no wiggle room anymore. Most health professionals follow what I call the black line, all right, which means that they stick to a procedure regardless of the overall context. So if a patient comes in and wants to ask some questions, or they may say, what you've put on the table isn't looking very good for me, they will hit a brick wall 9 times out of 10. So having the courage to step off is absolutely huge, particularly when the risks are high. So for example, I had a patient once who had a type of breast cancer, which the odds, 5-year odds, are very small, less than 10% survival. Mm-hmm. And it's like, you're being asked to go on a holiday on an aeroplane that may not get you to where you would like to be, and it's likely to explode in midair halfway through, and only the people in the cockpit are going to make it, right? Tiny amount. And so you're saying to your specialist, well, the odds aren't really very good. How do I make sure I'm one of those passengers in the cockpit? Right? And they will be told there's nothing you can do. It's just a lottery. Right? So your life is a lottery. Gaming it. And that, for many patients, in my experience, is not enough. It's not that people are looking to reach utopia. It's just that they want to end up somewhere that's acceptable to them. And that's how bravery shows up, or courage shows up in this arena.
So I'm really curious. Typically, when people show up to see you, so when a client comes for a consultation, do most people know where they want to end up, or are they confused about that? Have they been so kind of befuddled by their medical team that they haven't even got the clarity about where they want to go?
That's absolutely right. They're usually frozen.
Mm.
And it's the only space, if you're dealing with legal people or accountants, I put them in the same thing, is where we actually don't use our logic and reasoning. We think that because we're not equipped, that we can't make a decision. So most people haven't even thought, other than, I don't want to end up where they're taking me. So a lot of people used to come to me, and this, when I first started this work, I was going to give up my whole practice because people were coming who'd gone the medical route, or they didn't want to go the medical route, and they arrived with a huge number of treatments. So they were taking this treatment and this product, and they hadn't even, it was like, something's got to be better than nothing. Well, it isn't if you need to get somewhere fast. Right? So they didn't know how to, measure the value of whatever it was that they were taking to get them to where they wanted to be, but they hadn't determined where it was that they wanted to be, what that looked like, and then be able to align. So unless you actually do that, you can't hold a practitioner or their treatment accountable. There's no way of measuring whether it's taking you, even if it's incremental, there's no way of measuring that. So no, most people don't know what their endpoint looks like. Or they'll have an idea, but it's so unrealistic that no one's going to come on that journey with them. It's that incremental thing. It has to be incremental. You can have an idea. It's like going on a journey where you know where you want to be, but you're not going to feel that you know that you're on the right journey until you've gone to that first stop. You think, phew, yes, I'm on the right train. It's going actually in the right direction.
So you've worked a lot, and I believe that you still work a lot with people who are facing really serious health challenges. I mean, you've already talked about somebody who had, serious breast cancer, but you've worked a lot with people with cancer and advanced cancer diagnoses, haven't you?
A lot, great deal.
And so,
yeah.
So it feels incredibly overwhelming when you get a diagnosis like that for most people, because it feels like climbing a mountain. And I see a version of that in the people that I work with, which is that often people will show up who've had extreme flavors of childhood trauma. And there's a tendency to see the healing path for that as a kind of a mountain to climb. And I wonder if you can speak to a bit from your perspective of working with people who are tackling really big problems in terms of their health. How do you break it down into small steps?
It's really quite difficult, because most people who come, let's call it a wicked problem. There is no clear-cut answer, and yet that's what they're looking for. Just tell me what to do. So, for example, we did a project in the Logan area, which is south of Brisbane, and it's an area it's quite poor socio-economically. And there was a lady who came on that program, where we were testing the proactivity model. And she was frightened what she was clear about was where she didn't want to end up. All right. And she didn't want to end up, she didn't have cancer, but she had a lot of pain, and it was a condition, it was like fibromyalgia, but it was not that condition. And so she was worried about becoming addicted to opioids. Right. So that was, she didn't want to end up there. She just wanted a treatment that would work for her and mean that she wasn't addicted. So the opioids weren't working for her, and yet she was too frightened to come off them, because then she didn't want to put her health team off guard. So what she was able to do was to unpack, there was another key problem that she had, which was affordability. She was worried about becoming addicted to opioids, but she was also worried about ending up in the poverty basket. So her answer to fixing the affordability was to take on more work shifts, to earn more money, right? But the earning more money was making her sicker, right? So she needed to earn more money to pay for treatments that she thought should work. Okay, but she was going to get sicker in the process. So she could see through this, and we didn't actually, but because that was a grounded research project, it wasn't anything that we could give counseling or give advice. We had to allow people to come to their own light bulb moments. So when she was looking at this juxtaposition, she actually decided that she should save money. All right. And how was she going to save money? What was expensive? So she decided to move to a cheaper apartment, to stop eating out as much as she did, and to stop treatments that didn't work, that were too expensive.
Yeah.
All right. So she was, what's important for patients is you stay on your side of the fence. You don't try and figure out the medical thing, because it's not going to go anywhere. So she was able to go to her specialist and said, I haven't got a lot of money. These treatments aren't working. I'm frightened of becoming addicted. Can you work with me? What if I give them up? Can we do something different? And he was fine about that. So she didn't isolate herself, and she was completely shocked. So then she started looking at all her other treatments, and she was having physiotherapy because the muscles, one of the problems was that she was dislocating her joints. And she found that she was in more pain with this type of physiotherapy. So she thought, well, that's not working. So she'd lost the fear of being able to throw away the crutches. So because she made that window, she started thinking, well, maybe there's a physio who's got the same as me, or I can find someone who can give me appropriate exercises. But she found someone. So, and by the end of that year, it was a year journey. So the project lasted a year. Within the last 3 weeks of that project ending, she was off all pain medications. And she'd done that, and it didn't cost her anything. But it was the incremental thing of just being on my side of the fence. What does my condition mean to me? Not the medical ins and outs of, oh, I think I've got this, or not convinced of that, and this biochemical pathway is impacting that, so I need to take this product that hopefully can divert it, all that stupid advertising, which is why we buy so many products to fix the biochemical pathways. That wasn't going to fix it. Right. So it was just that, and it was a very incremental journey. over that year.
So, of course, I find this conversation delightful, partly because I talk about the power of tiny, brave moves. And so tell me if I heard you right in the context of that story. It sounds like a really critical, what I would call tiny, brave move for her was having the courage to tell her specialist what she wanted and needed once she had gotten clear on that.
Yeah, it absolutely is. But we had another lady on this program who was worried that the surgery she was going to have wouldn't work. All right, so she'd done her research and she said, I'm worried because I think I'm going to be back every 6 months for the same surgery. And I'm frightened. And she was going to go in for surgery and it was going to cost her 6,000 out of pocket. And she started to cry in the class. And I said, what's wrong? And she said, I'm scared. And I said, that's all you need to say.
Mm.
So she went to that appointment and she had an appointment with the surgeon before. And she burst into tears and she said, I'm scared. And he came round and he said, what are you frightened about? And she said, I'm frightened that if I have this surgery, that I'm going to have to come back because it's not going to fix it. And he said to her, you're right. He said, you are right. He said, but if you need it, we will do it. And then he said to her, I tell you what, let's do a scan because you're due to go in for surgery later that week. Let's do a scan now to see where we're at, and then we can decide whether you absolutely need it. So she had the scan, and he said, you know what? He said, come back in 6 months. You know, it was all because she was able to stay on her side of the fence and say to her, actually, where you're taking me may not be the best option.
Yes.
And you know, not every specialist is going to respond in that way. So as a patient, you have to think, when you have a specialist that you don't like, you'll be thinking, should I even be in the same room as this person? You know, if they're going to be intolerant, not listen, and you feel you don't have that line of communication, you can always actually find someone new. You know, ask around, ask your doctor, do you know of anybody who can cope with someone like me? And they might think, oh, well, no, you wouldn't get on with that person, but this person,
Yes.
why don't you go to that person?
Yes.
I remember once we had to go to someone and the specialist made the recommendation. He said, you are not going to like this person. He said, but remember, you're going because they are the best surgeon around. Right, but don't expect a bedside manner. You won't get it. And that was cool with me. That was fine.
Yeah. Kathryn, I know that you had a personal journey into this, let's call it the space of patient advocacy, helping people reclaim their power and become courageous in the context of their own health. Do you want to talk a little bit about how you came to this?
Yeah. Well, it was, I was really struggling for a period of years, say since 2002, writing this book on, it was to do with how does a person navigate their own journey. Okay, so I was beginning to write it. It's a book called The Smart Patient Journey Roadmap. And I was writing this book, and then suddenly a really close relative became very sick, and we couldn't get the treatment that she needed because there was a lot of she was young, and the treatment that we were asking for, no specialist would give to someone who was that young. So she was in her 20s. Okay, and she needed to have some surgery to the reproductive system. And she'd had lots of surgeries, and she kept ending back in A&E and torsion of the ovaries. And the whole situation was getting worse and worse. And every time they did the surgery, the adhesions were worse and everything was just jammed up. And yet we couldn't get the treatment that she wanted, because she ended up to a place where she just wanted a life. That was her end point. She wanted to be reliable. So at the moment, she was unable to be reliable in work, taking too much time off. She was a singer as well, so she couldn't be relied upon to turn up for performances. So her life had devolved into this experience where it wasn't worth living, and she couldn't get that treatment. And so what happened was I became her advocate, if you like. And I went into the arena for the first time in my life and experienced it as patients do, of when you become isolated or when you're accused. So I was accused of coercion. All right. And in Queensland, I don't know what it's like in other countries, but last year they put in place a law where you can become a criminal if you're found to have a coercive influence on someone.
Mm-hmm.
All right. So in the medical arena, for parents who want the best for their children, and the medical profession don't think that that's the best, the parent could be criminalized for coercion.
Mm-hmm.
I mean, thank goodness that wasn't around back then, but I was accused by one top specialist that that was indeed what I was doing for my ends. So it was like, that was when I really learned, do not step over your side of the fence.
Mm.
Okay, so the situation, this was the situation. This person had already had a surgery, and he'd said to her, you're going to be fine for 5 years.
Mm-hmm.
All right, so less than a year, we're back in that surgery with the situation worse than it was. And what's he proposing? We do the same again.
Mm-hmm.
So I come in, having done my research, and saying, well, what do you think about doing this or doing that instead of that? And he just turned his back on me, looked at this person and said, your advocate doesn't know what she's talking about. All right, so just complete medical gaslighting. Cancelled. I was cancelled on the spot.
Uh-huh.
Okay.
Uh-huh.
I burst into tears. I went to the corner of the room, grabbed the hankies, the paper hankies, and I didn't hear the rest of it at all. It was totally cancelled. So it was like, after that, we left, and I thought, where did I go wrong? Now, if I'd said, or if she'd said to him, well, we've already done that and it didn't work, we would have got a different response. Right? It was the obvious, to be able to just state the obvious. You know, or if you do that, how long do you think it will last this time? You know, completely different. And that was the biggest part of that journey, where I have now understand the power of being in your own space and never crossing that line. To be able to speak from your side of the fence, your experience. And it's hugely powerful. And I think a lot of people find it difficult and find it too painful to actually say, what does my health mean to me? When you've got that, you don't want to look at that because you're looking at the odds of where you could end up. It's too painful. So you'd rather bury your head in the sand and just go where others take you, because you don't want to look at the reality. And I think the pain is for people is that, and that if you can alleviate that, like in my work, by unpacking the reality, and then you start to see the possibilities. When you start to get your reference points, you know, as I coming back to what I was talking about, using our logic and reasoning, when we freeze, that all goes out the window. We go offline. And yet, in everything that we do, before we make any decision, we're cross-referencing. We've got reference points, so we can work out the odds or the probability of something being fit for purpose. So we'll know what the problem is, what we want fixing, what we might need in order to fix it, and how we can tell if it's being fixed. Okay, so there's these reference points, and we just do that automatically. In health, so my program, if you like, it helps you to become objective. So we pull out these reference points, which are subjective, but then we stand back and we can see, we can start to work out the pathway by choosing things that are aligned to where we want to go. So for example, I had one man who came 10 years ago, all right? He was in his 70s. He had kidney cancer. He'd had the kidney removed, but it had spread and it was in the lungs. And he was on treatment that wasn't working for him. And he was in his 70s. So he comes into my office and he'd been given 6 months. Okay. So I said, what would you like? And he said, I'd like to live another 2 years because I've got one grandchild just born and another on the way. Right. So he was really clear. He just wanted to live. And he said, can you help me? And I said, well, let's have a go. Let's try. And so we started on the program and he came back. So I do diet, so it's improving your capacity to respond to any treatment, right? We're not saying it's a cure, but it improves your capacity. He came back and he said to me, he said, this was about 6 months down the track. He said, my specialist's really happy with me because her treatment started to work, right? So it wasn't dead. That was the first waypoint. I don't want to be dead in 6 months.
Yeah.
This is really simple stuff. That's where I'm heading. Want to go up, not down. So she was really pleased. He said, I haven't told her that I'm doing this because I know that she'd just, deflate me. So he's asking all these key questions. And I said to him, you're a really shrewd operator. And he said, yeah, he said, I was a CEO for a global freight company. I was brought in for those reasons. And I said, I think you're going to get what you want. All right. So what he wanted then, he wanted to come off the drugs because they were giving him side effects. And he knew by then that it wasn't the drugs that had got him to that place.
Mm-hmm.
Okay. So you're using these reference points. So he went and he negotiated with her. And she said, if I take you off the drugs, you can't go back on them without paying for them because you have this black line. Let's follow the black line procedure.
Mm-hmm.
So he said, well, they're giving me all these side effects. And she said, I know what. She said, what I can do just outside the black line is I can put you on a drug holiday, which means we're just stopping them. For what? it's just like, it was brilliant. So he's in charge of the journey.
Yes.
He's really clear about these waypoints. And you know, Belinda, I contacted him a couple of years ago because I wanted to ask him something, and I'm thinking, well, I don't know whether he's going to be still alive. And he answered the email and he said, I'm doing fine. You know, he'd been given 6 months. He said, I'm doing fine, and I've got 3 more grandchildren.
Oh.
You know, just absolutely, absolutely amazing.
So you're soon, as we're speaking today, you're about to run a short program that takes people through some of this work to get clear about what they want their endpoint to be and what some of those milestones and reference points might be. Do you want to talk a little bit about that?
Yeah, it's I call it the Ready Reckoner course, because Ready Reckoner, it means that to be able to filter things through fairly quickly. So that means that you need to unpack those. There's 5 reference points, and what we do on the course is we unpack each of those and we put it on a map, a road map, and that becomes the war room. And it means that you can use that with any practitioner so that they can understand where you are, where you're heading, where you don't want to be, and what the incremental measurements are. So everybody gets it. And this little roadmap was developed as a consequence of this same person that I was advocating. She then had to go and have a psych report to make sure that to show the medical team that she wasn't mad. And she'd done one of these roadmaps, and she took it with her to the psychologist, and she was in there for about 2 hours. And I was very nervous because I thought she'd blown it. And when she came out, I said, you were a long time. Is everything okay? And she looked at me and she said, yeah. I said, what happened? She said, well, I took the roadmap out. And she said, we just talked about the roadmap. And he said to her, can I keep this? And it was on the roadmap. He could see that she'd actually thought about anything, that she wasn't driving blind. And one of the problems practitioners have, and I have it myself, is when a patient comes and they are in the driving seat and they've got a blindfold on and they say, this is where I'm going and I want you to be in the seat and navigate. And I'm saying, you're heading for a brick wall because there are risks out there. I'm getting out. All right? So this roadmap, at a glance, well within those 6 minutes that you've got with the doctor, will show them that you are not driving blind, that you absolutely know what the risks are, that it's being factored in, that you've got a plan and you want to work with people who can support you getting you to where you want to be.
Yeah.
And that's what the roadmap will do. So yes, so the course is about how do you set up your roadmap? How do you get your line of questioning?
Yeah.
How do you stay on your side of the fence? How do you be safe?
Yeah. That's a lovely explanation, Kathryn. I mean, I've done some of this work with you before in a different format as part of a longer course. I love this new iteration of, just a handful of weeks to get yourself a roadmap. I'm excited about it. I will, for anyone who's interested, I'll pop links into the description underneath this video and you can go check out that course that Kathryn's offering and the other work that she does. You still see one-on-one patients, is that right?
I do. I'm doing everything.
Yeah.
Teaching, building courses, I love it.
Yeah.
So fulfilling.
Yeah. Yeah.
Because I always say to people, you can have two people with the same illness having the same treatment. One person makes it and the other person doesn't. What's the difference? It's not the diagnosis, it's not the treatment, it's the patient's capacity to respond to the treatment. And it's that improves your odds. And of course, if you can remove all the stress and to just have confidence, like, yes, I am made the right decision and I am in the right place, that is huge, absolutely huge. Means that you've stopped running round and round in circles and going nowhere.
Thank you, Kathryn. Is there anything else you'd like to finish with?
No, I think that's about all, really. I'd just like to thank you for the conversation.
It was a good one. I feel like we could talk for days about medical gaslighting. I'd love you to come back sometime and we could talk about some other things.
Well, I will do. I will. Yes. Yes.
Yeah.
Just pick a few juicy topics.
Yeah. Let's do it. Kathryn Alexander, it's been such a pleasure to have you. Thank you so much. And
thank you.